We can be the best healthcare provider in the world. We can be so committed to technical excellence. Our staff can be committed to technical excellence. We can dot our I's and cross our T's, but if patients don't perceive that we care about them, if patients don't feel connected, informed, and safe, then it doesn't matter.
Welcome to Success Confidentials.
9 minutes every week that'll level up your practice. If you're a healthcare visionary obsessed with patient experience, team culture, marketing, and growth, you're in the right place.
We are too. We're Lauren
and Christine,
the patient whispers. We worked together for 4 years as leaders in a real premium practice.
We did not play in the traditional healthcare sandbox and believe human emotions drive all success, and it really, really worked. We grew our cash pay practice an average 60% year over year.
And on social media, we grew our followers from 1,000 to 14,000 in just 2 years, generating millions in annual revenue from social media alone.
So now we're out here sharing what made us wildly successful so you can be too.
Let's have some fun.
Let's dive in. Today we want to talk about something that is a little bit of a touchy subject, but it's important. It's an important conversation to have. We're talking about liability, and our best protection in healthcare is soft skills.
Yet it is one of the most neglected skill sets in healthcare for us and our staff, who typically spends more time with the patients than we do.
We're talking about patient perception. We can be the best healthcare provider in the world. We can be so committed to technical excellence. Our staff can be committed to technical excellence. We can dot our I's and cross our T's, but if patients don't perceive that we care about them, if patients don't feel connected, informed, and safe, then it doesn't matter.
Because if they don't believe that we care, they are more likely to point fingers and find fault.
And when you research why people file malpractice claims, the number one cause, this is really surprising, the number one cause is not inappropriate medical management. It's a lack of human connection. So in this case, in this scenario, soft skills make all the difference. If we aren't prioritizing and using soft skills with our patients, if our staff and the team around us aren't equipped with soft skills and know how to use them with patients, we are opening ourselves up to liability.
And if you dive deeper into research and look at recordings of doctor and patient interactions that did not result in malpractice, you see that the doctors use humor. They ask the patients questions and allow them to talk. They listen and explain what is going to happen throughout this visit.
We recently read a really interesting article by Dr. Adrienne Boise, who is a neurologist and also is the Chief Experience Officer at the Cleveland Clinic. What I loved about this article was how she articulated what she believes is one of the most powerful things we can do for a patient, and that is to 1, ask them about their insights and their feelings, 2, reflect that back to them, and then 3, do something about it.
She calls this concept empathy operationalized.
I love that.
So in summary from today's conversation, we have to prioritize, invest in soft skills for our entire staff. It is one of the best ways to protect us and our practice and create an exceptional patient experience and increase conversions.
That is a win-win-win, which is why we developed an in-person or virtual soft skills training program that is designed for everyone who is patient-facing in our practice, specifically for interactions with patients in healthcare, so that we can make sure our patients feel connected, informed, and safe with us. Message us for information. If we can help you with anything related to today's topic, use the link to schedule a free 30-minute synergy session just for new practices.
For our existing practice clients, you already know where to find us.
Now we want to hear from you. What resonated? What other topics are hot for you right now? We want to know all about it in the comments.
We're just a comment away, so if you have any questions, we personally respond to all comments and DMs. If you're not subscribed yet, make it easy on yourself to see new episodes and reference topics that are helpful by hitting the subscribe button.